The thing that excites me most about the Essential is the embracement that our faculty has had toward this curricular intervention. We at Indiana University have faculty that their whole scholarship and focus and pedagogy and research is focused on education. So when the Essentials were published, they eagerly reviewed and eagerly adopted the idea that this was the direction that they wanted to go. So very early, it was not so much a dean administrative kind of decision. The faculty reviewed and were very eager to get started on this work. So I'd say that is the first and the most important priority, is that the faculty endorse the work, particularly when the curriculum are owned by the faculty. So I couldn't be more delighted and excited to see their enthusiasm, the way they've organized and really gotten right to it. The approach is really just a faculty-driven approach, and if we think about the systematic process that we used, one of the first things that the faculty did was to assess who we are. We're an academic health center. We have 3 campuses, so we're complex. The faculty governance is across those 3 campuses, so it's important that all are involved in this curricular revision. So they assessed our assets, if you will, and they assessed our capacity and what kind of organization that they needed to get this work done, and the resources available to them. And next, they really got the organization ready to get started. They made a commitment to download all the tools that were available through AACN. They got these toolkits and used those, the assessments that were available, the mapping tools that were available. So they made sure that they had access to all those tools that were available and very easy to retrieve. They also watched the webinars. We talked with other people that were in the process of evaluating the implementation of the Essentials, as well as conducted a webinar ourselves for AACN with some results of some of our early work. One of the things that our Executive Associate Dean Rebecca Ellis did was she hosted a Kaizen event, which is a performance improvement, if you will, or quality improvement kind of technique that brings people together to really visualize what kinds of strategies we need to use or what the themes of the major win-wins are in this work. So leaders from our health systems and leaders from the school met in a day-long retreat. We came up with a number of themes that were very important that will then turn into a plan, an action plan of how we're going to embed them into the Essentials. And our practice partners are going to be involved in this and provide lots of feedback. We have very healthy partnerships, academic clinical partnerships. We will want to promote them and expand them by the use of the Essentials, and they'll be involved in this.